Hello, today I will be talking about trauma and stress in early childhood and how it can affect a young child's development and how educators and families can support that child through social emotional learning strategies. Some common examples that we see are abuse or neglect, domestic violence or family conflict, or the loss or separation from caregivers. Some common signs that we may see for stress and trauma in children can include aggressive behavior or increased irritability, while other children might even be withdrawn, quiet, or usually fearful of adults. Another sign educators may see often is a regression in skills. So children that were normally potty trained or could speak really well see a regression in those skills. They start wetting themselves more, start to become less wanting to do work. These children may also experience difficulty with sleep or other physical symptoms such as headaches, stomach aches, without really a true medical cause. Trauma affects children differently. For example, children that are birthed to 24 months old, they tend to rely a lot more heavily on their caregivers to feel safe and to feel cared for. If they experience trauma in this stage, it can interfere later in life with their ability to form attachments and to be trusting of adults. Preschool age children, normally from about 3 to 4 years old, experience trauma differently, and then the way they show it is while they're playing in centers, they may repeat events that they've seen at home that are frightening and concerning, and they may also display aggression, fear, separation anxiety, or difficulty following simple routine. Children that are a little older, normally 5 to 8 years old, trauma can affect their concentration, their memory, and their learning, which can lead to lower academic performances. It's important for educators not only to be trained in noticing signs of trauma, but also to be trained in social emotional learning, because as educators, we play an important role in supporting children who have experienced trauma. Training educators in social emotional learning strategies help create classrooms that feel safe, supportive, and predictable, which is especially important for children who have experienced trauma, stress, or crisis in their life. One social emotional learning strategy that educators can implement are establishing predictable routines. Children that have experienced trauma rely on stability and knowing what happens every day at the same time every day, and having that predictability can allow them to feel safe and trustworthy in what's coming and what's happening next. Another strategy is creating a calm down space in the classroom, a space that is used for children when they are feeling overwhelmed or overstimulated to go and take a break. Now, this is not meant to be used as a timeout area or as a discipline area. This is meant for a child that is feeling overwhelmed, that needs a brain break to go and cool down, relax, use some sensory toys, some sensory tablets, and take a moment before they rejoin the class. One last strategy is teaching emotional literacy. Teaching children how they can identify and express their emotions using feeling charts, feeling buddies, or books about emotions can encourage discussions and encourage children how to name the emotions that they're feeling. Families also play an incredibly important role when it comes to children coping with trauma and stress. Families can support these children by maintaining consistent routines, encouraging open communication, providing reassurance, patience, and emotional support for these children when they are feeling unsafe, when they are feeling overwhelmed, when they are feeling overstimulated. Lastly, early childhood educators have an ethical and legal responsibility to protect a child's safety. We are mandated reporters, which means we are required by law to report suspected child abuse or negligence to the appropriate authorities. As educators, we are there to carefully observe and document signs of possible abuse. We do not need proof of the abuse to make a report. Reasonable suspicion is enough to fulfill our legal responsibility. Working together, educators and families can help children develop the emotional skills they need to cope with challenges and thrive both in school and life.